Nestled deep within a large expanse of forests in Wayanad, Kerala, is the largest population of Aboriginal tribes in India.
In Wayanad, there are several tribes, mainly Kurcha, Kurma, Paniya, Urali Kurma, Padiya, and Kataneka.
A visit to a typical Vanavasi hamlet will reveal many things. However, one of the biggest challenges they themselves face as a community is the presence of sickle cell anemia, a genetic blood disorder that is passed down from generation to generation, from parents to children of these families. Furthermore, the lack of clean drinking water, unhygienic living conditions, and malnutrition among the Adivasis did not help the situation either.
അതൊക്കെ ഇതിലൂടെ വർക്ക് ചെയ്തിട്ടാണ് ഈ കുറേ മദ്യപാനം ഈ കോളനിക്കെന്ന് വെച്ചാൽ ഭയങ്കര ഈ സമയത്തൊന്നും നമുക്ക് പിന്നെ ഇവിടെ ഒന്ന് ഇരുന്ന് വർത്താനം പറയാൻ പോലും പറ്റില്ല ആ ഒരു അവസ്ഥയായിരുന്നു ഇവിടെ. പക്ഷെ ഇതിലൂടെ ഞാൻ വിവേകാനന്ദൻ്റെ ഇവിടെ പോയത് കാരണം ഇതിൽ കുറേ മാറ്റങ്ങൾ പലർക്കും എനിക്കറിയാൻ പറ്റുന്ന കഴിവുള്ള ഇതൊക്കെ ഞാൻ ചെയ്തു കൊടുക്കും. അതുകൊണ്ട് ഇവർ വരുമ്പോഴും ഭയങ്കര സപ്പോർട്ടാണ്. ഓരോ മാസം മെഡിക്കൽ ക്യാമ്പ് വരുമ്പോൾ അവർ അന്വേഷിക്കുകയാണ്.
It was the introduction of the Swasthya Mitra project, a boon initiative by Sewa International, that brought a flood of relief for Bindu and several others in the village.
8 വർഷമായി സ്വാസ്ഥ്യ മിത്രയായിട്ട് ഇവിടെ പ്രവർത്തിക്കുന്നത്. അതിന് മുമ്പേ ഇവിടെ കോളനിയിൽ അങ്ങനെ ഒരു വികസനം അതൊന്നും നടന്നില്ലായിരുന്നു. പിന്നെ അതിനുശേഷം ഞങ്ങൾ പിന്നെ സുജന കോർഡിനേറ്റർ എല്ലാ കാര്യത്തിലും സപ്പോർട്ട് ചെയ്ത് ഞാൻ മുട്ടൽ വിവേകാനന്ദ മിഷനിലേക്ക് എന്നെ എടുക്കുകയും കാരണം ഞാൻ പിന്നെ സ്വാസ്ഥ്യമിത്രയായിട്ട് പോലും ഇവിടെ കോളനിയിൽ പോയിട്ട് മരുന്ന് കൊടുക്കുകയും ഫസ്റ്റ് എയ്ഡിൻ്റെ ആയിട്ട് കൊടുക്കുമ്പോൾ അവർക്കൊരു ആശ്വാസം കൂടിയാണ്. ഏത് രാത്രിക്കാണെങ്കിലും ഇവിടെ ഓടി വന്നിട്ട് ഫസ്റ്റ് എയ്ഡൊക്കെ മേടിച്ചിട്ട് പോകും.
The Vivekananda Mission started a mobile medical unit in 1992 to provide healthcare to those tribals living on the periphery and most often in the interiors of the forest, with no bus service or means to travel to Muttil.
They are very much innocent people. They are very, very innocent people. They are not at all jealous on others. They are not money-minded. They don't even think about their future. There is no savings for them for next month or like that. They live their present life happily. There is no divorce in them. But only thing is that malnutrition is one problem. Then hygienic problems, like that problems they face.
A mobile medical unit of the mission leaves almost every day to far and remote corners of Wayanad to reach the Vanavasi patients living in the periphery of the forest.
Where the people can't reach a hospital, or where these rural people, they don't have money to even for their bus charge, where there is no bus service, like that areas we choose. In 1 year, more than 365 medical camps will be there. But one day, there will be 2 medical camps or 3 medical camps.
Sewa International added a new feather in their cap when they decided to undertake the matter of public health and deliver it to the doorsteps of the underprivileged. With the help of volunteers like Bindu, the doctors are given comprehensive medical reports for each of the residing tribals in the area, who in turn listen to individual ailments and conduct thorough checkups. Whatever the weather conditions, doctors like Ashwini travel from colony to colony, providing free healthcare and medicine, because for them, these people are a priority. dwellers of these hamlets will get the facilities of hospital at their doorstep. The unit has all the necessary equipment and personnel to give treatment and essential medicines. Those who are diagnosed with sickle cell anemia are immediately referred to the Vivekananda Hospital in Muttil. The Swami Vivekananda Medical Mission, founded in Kerala in 1972, has now grown extensively as a primary healthcare center. With a fully functioning laboratory and stocked pharmacy, they are able to treat an average of 1 lakh patients a year, 75% of which are the poor and helpless tribals. The hospital also boasts of an IP ward consisting of 36 beds, an operational ultrasound scan and X-ray unit, and multi-speciality clinics conducted by visiting senior specialists from Calicut Medical College and other esteemed medical institutions.
After doing Swasthya and this Samparka, we have found out that only single point approach is not sufficient for the betterment of our Vanvasi brethren. Then we have decided that we should have as our aim total development of our Vanvasi brethren.
The Vivekananda Medical Mission aims to not only improve quality of life for the tribals, but also engage them in holistic activities pertaining to education, culture, and economic welfare. With the help of their dedicated and selfless volunteers, the mission aims to fully develop these tribal colonies, making them self-sufficient and reliant, with a chance for a better life.
Requesting Shamji to kindly introduce Sewa International.
Namaste and welcome to everybody, especially Dr. Dhananjay Sagdeo ji, who hails from the same city that I do. And after his graduation in medicine, he decided to trod a different path. In Marathi, there used to be a monthly that he and me have read, and there was a column called Kahitari Naves Kara. Do something innovative. Not the path that everybody has walked. And Dr. Sagdeo has rightly chosen for his life a different path. We listen to Dr. Abhay Bang, who also hails from the same city. And he then worked in Chandrapur and Aheri district. However, Dr. Abhay Bang, who was one of our speakers 2 months back, had his activity area that his father also worked, because he being a Gandhian, he did work in those areas amongst the tribals. However, Dr. Sagdeo has chosen Kerala, and that also Kerala's, North Kerala's tribal district, Wayanad. And this was surprising to many, because he being a doctor, any doctor would have preferred to be in the urban areas. And big cities do attract a lot of doctors. We have a problem where the doctors don't go to villages or far off places, leave alone tribal areas. However, this young doctor decided to go to Wayanad, of course, guided by Dr. Abaji Thatte. He joined a small clinic located in Wayanad district, where a big hospital has come up since last, say, 37 years. He is there, 80 he went, so it is 42 years now. Sorry. 42 years. Years pass by like fly like that, you know. It was really difficult those days. Those were the days when it's an elephant reserve, and off season, because the elephants don't get the fodder, they walk into villages, and whatever cooked rice, of course, they adore, they like very much. And in the nights, pushing huts or pushing their trunk into huts, they will eat all the rice that's cooked. Those were the days he started working there. And he is one of the most popular doctors in that area. He has specialized in many things, of course, because areas like sickle cell was prevalent over there. He took up that up, partnering with some big medical institution, say in Kerala, say in Tamil Nadu, neighboring Tamil Nadu, who worked there. And on one of my visits to Wayanad, I listened to an experience where a doctor from Americas, of course South America, Guyana, or a British doctor who also worked in Guyana. British doctor was there. So he attracted a lot of people and a lot of resources, breaking the greatest difficulty among the doctors. How can they go out to tribal areas and work there successfully? He is an ideal for that. We all are aware that he was awarded Padma Shri this year. So we all congratulate him. We will be listening to him, his experiences over there, where he was not knowing the language. He mastered the language. He of course communicates with them in their own language, and established the hospital in the process. And is very popular, so much so that there used to be a missionary hospital earlier, which was popular. But with the rise of Swami Vivekananda Medical Mission, which attracts most of the tribals, with the network of schools, the single teacher schools, then medical vans that you just watched on the screens, and all that. He has done a marvelous job over there amongst the tribals, gaining their confidence. And you all need to visit his project to understand it in its right sense. Though we have an opportunity to talk to him, to ask him questions, to understand what he has been doing there. So it's over to Dr. Sagdeo, but before that, Dr. Sagdeo ji, we had been holding this Sewa Samwaad for more than 8 months, and this has been a very successful program because this is live on YouTube and Facebook, and people watch it, even though sometimes, because the world over Sewa International is active in 26 countries and more so with HSS collaboration. So wherever this link goes, many people watch. So it's a global program we're trying to popularize. तो आपका स्वागत है. Over to Dr. Sagdeo ji. Namaskar.
Namaskar. A warm good evening to all the participants of this Sewa Samwaad. I am really happy that I am part of Sewa International, and now I will be sharing. I am not a guest here. I am part of the Sewa International working group. We are collaborating with Swami Vivekananda Medical Mission. So it is all our, in short, it is Parivar. And Shamji is our guiding and philosopher also for so many years. So under his guidance and under the patronage and support from Sewa International, we are working in Wayanad. So I'll start with a few words about myself, how my journey from Nagpur to Wayanad and now medical missions work, and then we can have question and answer because that will be more fruitful. People will be, so many will be interested to know specific ideas so that we can interact at the end of my short speech. I will not be taking long time. Initially, about myself, I am from Nagpur, as Shamji told, from our hometown. So usually people ask, that is the question, how I landed in Wayanad. In Nagpur, I studied MBBS from Indira Gandhi Medical College, Nagpur. When we were studying in Nagpur, there is a rural area. One Swami Vivekananda Medical Mission is there in Khapri. So when studying, we were visiting that area. It was a remote area and really very no health facilities. You can imagine health facilities all over India also, and especially rural in 50 years ago. So really the situation, even if it was nearer to Nagpur, it was pathetic. And then one incident happened. When we were visiting there, one of the doctors visiting was Dr. Siledar. He is one of the first person, actually we can say that he is the first doctor couple who decided to work in tribal area. In those times, he and his wife went to Lohardaga and started one hospital. So because of emergency, they were to return back. But he was the role model for me, that one doctor who can work in tribal area. So because of his words and his living example, that was the motivation part. Second part of the motivation was from Sangha, because we are daily going to evening shakas. Then I attended RSS OTC, means Sangha Shiksha Varga also. So during Bodhiks and discussion with our adhikaris, there was always need, and we were told that everybody who is working in our society, we have to do something what we can do for our society. So as a doctor, then it thought came to my mind that because I am becoming, my medical knowledge should be utilized in such a way that it will be fruitful and it will be useful to the society, and where there is no doctor. So I expressed my opinion that I am ready to work wherever Sangha decides. Then I discussed with this, that time, Sarasanga Chalak, Pujaniya Shri Balasahebji Devras. Then on his advice, it was decided that in Wayanad, Kerala, the Swami Vivekananda Medical Mission has started a small unit, but there was no doctor available because it is really remote and most backward area. So I was directed that I go to Wayanad to work and help our disadvantaged section of the society. So with this motivation and direction from Pujanesh Devarasji, I landed in Wayanad in 1980. So immediately after MBBS. Then you can imagine in 1980 what is the situation of a tribal area work. If you can take small example, if few visits our jungle safaris or tribal or forests for tourism, then you imagine going to forest now also without electricity, no lights and no other communication. This type of atmosphere, the tribals were staying there. In Wayanad 50 years ago, there was a huge disparity. Now also it is there between tribes and non-tribes. Tribes were literally disconnected from our national mainstream. There was no education, no health facilities, no communication, no roads, no transport, and there is huge disparity between the development of our tribes and non-tribes. When we say that India has developed a lot in the last 40 years, but there is a huge disparity between our haves and have-nots, that is the tribes and rural tribals and other people. There is a huge disparity and there is access to healthcare and there is a big challenge. So when we Medical Mission started the activities for health purposes, there are two motives. One is to solve the health problem, but second was Kerala, you might have heard, and especially tribal areas, they are actually exploited by non-tribes. And in these jungle areas, these anti-national activities are also going on. So when our Sanghadikaris and other people decided that we should do something for our disadvantaged society, so one of the reason or one of the way is to help our brethren is health. So Swami Vivekananda Medical Mission Kerala was started in 1972, but unfortunately no doctor was available to work. Only one or two for a few years they came. So when I reached there, with literally this was the situation about the tribals. There were no patients, they were not ready to come to the hospital. Then absolutely no communication between them. Then I am new, no language, everything, atmosphere new, food habits new. So slow, but because I have decided that I am going to work there. So this type of difficulties were part of life. I accepted them. Gradually I learned the language. Then we started visiting the tribal colonies with the help of our local workers. And then earned their trust and faith. And then only when they started knowing me and thought that I am their friend, then only they started come to hospital and started taking medicine. So that was the beginning. Then what happened when gradually we found out that this problem of international activities and so many this backwardness, we had to do something different. In that situation, Shri Nanaji Deshmukh visited our hospital and then we visited our tribal colonies. Then there was discussion with tribal youth, what they want. Then one tribal youth told Manaji that we want to become like you. That was the biggest turning point. So that is the aspiration. That is the aspiration of a tribal youth, that we are different and they are different. So we want to become like you. That was he said. Then there was discussion with Nanaji Deshmukh and then with other adhikaris, and we decided that only health aspect will not be sufficient. So it was formulated that we work on total development of our Vanvasi brethren. So a 5-point program was evolved. So it touches all the 5 aspects of our life. So one is Swasthya, Shikshan, Sanskar, Swalamban and Samajik. So on these 5 principles of S, we decided to formulate our strategy, and gradually we developed our hospital and field activities, and slowly earn the faith of our Vanvasi brethren. Then I will tell short of this, what activities we are doing under 5 heads, so that then we can expand on our work being done. First is Swasthya. In Swasthya, we are having a 35 now. In last 40 years, there is development. So I will tell what the present situation about Swasthya is health. Health is most important aspect, and we are trying maximum to help. And in last 40 years, from a small clinic, we have developed into a 35-bedded, well-equipped hospital with the help of so many institutions like Coffee Board, Tea Board, and Sewa International. So we have got 35-bedded hospital with all the minimum good X-ray, ECG, scannings, and good laboratory. Now, with the help of last year's COVID help from Sewa International, we have got ICU also. So we are trying to maximum do about health. In health, our hospital nearly treats daily 200 patients. We are giving completely free treatment, and who are admitted, and bystanders free treatment. Food also is given. In Swasthya, we are doing special is sickle cell anemia. Sickle cell anemia is a genetic disorder, and it is found in so many tribal communities and SC communities all over India. In Wayanad, it is very common, and when I went there, I saw few cases. The main symptoms of sickle cell disease are body ache, jaundice, severe anemia, and if the patient goes into crisis, there is sudden death. So there was no diagnosis at that time. So with the help of Mr. Chauhan, district collector of Wayanad at that time, AIMS Delhi team visited our hospital, and we conducted small survey. Then with the help of All India Institute of Medical Science at Delhi, we conducted one research project. That is the only one project done by AIMS Delhi for all over India. For 4 years, we screened 1 lakh our Vanvasi population and for sickle cell disease, and distributed them cards, red cards for deceased patients, blue for carriers, and white for normal patients. And then marriage counseling was done to prevent the marriage between the carriers and deceased patients. So our aim was to have a sickle cell disease free Wayanad. So after the project done with AIMS was over, we are continuing, and now still we are continuing and doing screening, and we hope that in future, with our help from the Sewa International also, we can fully control or eradicate sickle cell disease from Wayanad. Second important was COVID. In COVID also, last year, we did a very good job, and with our organization, and with this full support from Sewa International, we established 27 COVID help desk centers in 27 panchayats. And we did all the necessary help for the local community, because it was a really difficult situation in pandemic. So COVID help desk, there was absence of public transport, loss of livelihood, absence of wages, and no hospital access. So Medical Mission, with the help of our mobile medical unit and help desk, we helped the patients and supplied kits also, and whatever can be done to tide over the crisis. All the help was given to our tribal communities especially. And vaccination camps were also conducted with the help of government. And most interesting thing was that our tribal patients were preferring only Muttil hospital, our hospital, for vaccination, because they were having faith, because there were some apprehensions. So the government said that all the tribal patients, they will be vaccinated in our hospital. So that was one of the biggest achievement, that we could help our tribal community in COVID times. So that is another health related activities. Third health related activity is our Swasthya Mitra scheme. We have trained with the help of this help desk, tribal youths are trained and given first aid, and training are also given. And now with the help, our Niramaya kit has been distributed. So they are giving a very good help to local communities and giving health education, and minimum medicines will be there. So first aid also is given. So that way our Swasthya Mitra scheme, our workers are very helpful, and that is our medical camps also they are arranging. So Swasthya Mitra is our huge potential to help our community to tide over all the health related issues. Second most important aspect is our mobile medical unit, which is also supported by Sewa International. Daily our vehicle goes to the different Vanvasi areas. Nearly 400 medical camps are conducted per year. And remote areas we are going with doctor, paramedical staff, and medicines and laboratory. And all the medicines are given, minimum laboratory tests are done, and if they are necessary, they will be transported to our hospital, and further treatment is given at our Muttil hospital. Medical camps are conducted with the help of our national medical organization, Sewa Bharati also. So many medical camps are conducted in remote areas. In last year, when floods were there, we conducted literally, we had to wade through, take boats and travel where the submerged tribal villages. We were the medical mission was the only mission who took the medical help in this because of floods. It was a really huge problem in Wayanad because there was no other facilities. So we were able to reach the needy in this difficult situation also. Then health-wise, tuberculosis we are doing the de-addiction center, and other activities are visiting by specialists. One Dr. Mukunda Swayamsevak from Hyderabad, he visits every month and conducts cardiology camp. Contrast Eye Hospital, we are doing cataract operations and camps per month. De-addiction we are doing. So health-wise, what we can maximum do, we are trying to do. Second is education. Education is one of the most important aspect of our life, and we are trying to improve the educational status of our Vanvasi brethren, because then only there is socio-economically there will be change. So to improve the education, we are having one tribal school in one Cherugara where there are 150 tribal students are studying. Then most important is one teacher schools. We have got 125 one teacher school in different Vanvasi remote areas where daily 2 hours tuition centers are held, and to help the local tribal students who are finding it difficult to get help for the education, and there are huge dropouts. So because of our schools, dropouts has reduced and the educational standards are improved, and this who are going to local schools, their teachers are saying that the students who attend our classes, their educational standard is going up. One of the happiest moments is that because of our stress on education, the general educational standards in our Vanvasi community is going up. And I am very happy to say that in last 5 years, nearly 5 MBBS doctors have passed out from our Vanvasi community, and 2 doctors are actually working in our hospital. So that was the biggest happy moment because of our work. So that is good thing which has happened because of our activities. Third is our Bal Sanskar Kendras. We are working to have the cultural this thing. Then Swawalamban, we are having self-help groups. 40 self-help groups are there. Vocational training centers. bamboo craft training centers, tailoring centers, production centers. So main aim is to improve the socio-economic status so that they become Atmanirbhar, because our Prime Minister Modi ji is saying that Atmanirbharta is most important, and Sabka Saath, Sabka Vikas. So on these principles, we are trying to help our disadvantaged brethren to help to earn their own livelihood and become Swalamban and Atmanirbhar. That will give them great pride and they become self-sufficient. Last is our Samajik. Our Gram Sewa Samitis are there in different areas. They look after all the local needs of the community, and our one teacher schools and medical camps, all activity, other problems, they sit every month and discuss their own. So on these 5 principles, we have tried to help our brethren. Say, after another 3-4 points are there, then we started activities on Wayanad. Pujaniya Sarasanga Chalak Shri Devarajji has told specifically that we should not go for a big hospital, because when it is big hospital, then it becomes a big, and then you have to, whole energy is consumed in running a big hospital. So we should not grow vertically, we should grow horizontally. That was his most important message and direction. So we have our Muttil hospital is a very good family health center, and because of horizontal growth, we are reaching most of the remote corners of Wayanad with our medical camps, one teacher schools, and other field activities. Telemedicine is one of the activities we are planning, and few centers we will be establishing slowly. So this way, we are trying to touch all the facet or life of our Vanvasi brethren, and trying to improve the general living standards and make him Atmanirbhar. So this is in short what we are doing, and I will be glad if some more people who are interested on specific questions and specific subjects, we can answer. Thank you.
Thank you, Dhananjay ji. It's I'm hearing you for the 3rd time, and it's always inspiring and energizing to hear your journey. There are a lot of questions around health that we have already received from people who have registered, and there are some questions about working with tribal specifically. So I will try to cluster the questions as they are and ask combined questions. So one question that we have is about working with tribal people specifically. You mentioned about acceptance is a big challenge. And we have heard this multiple times whenever anyone talks about working with tribals, as acceptance not being there initially. How do you build trust in a community? Is there some ways that you have tried and that they have worked?
Yes, when that is the most important thing. Anywhere when you go to, especially Vanvasi areas, who are there is actually suspicions. When they are disconnected from the society for last so many, we can say, thousands of years, they are already disconnected from our national mainstream. So anybody new man comes, then they will be always suspect his motive, why he is there. Because there are 2-3 things. One is, for last so many years, I am not going to politics, but there is exploitation of them from the non-tribes, what means other people who are there. And they have, in Wayanad also, there is encroachment of their lands and their livelihood, and other Naxalites, anti-national activities are there. So there is always suspicions about the new man coming, and especially I am coming from Nagpur, coming to Wayanad, not knowing language also. So that was a very big challenge. But fortunately, our Sangha work and Vanvasi work was there, and there were few contacts. So initially, we purchased one small motorcycle and started visiting the colonies and making friends. So that was the biggest first step, going to the colonies, talking with them, meeting them, and telling them why you are there. Because doctor is there, there is some hope that doctor is always welcome, because there will be some illnesses. So we take with some medicine, then one or two people will be ready to get examined, take medicine also. Then they become better. Then they will tell that yes, he came and he gave medicine and now my child is fine. So by word of mouth, and then going there, and then they started loving that somebody from all the way from Nagpur who has come, and he is coming only for us, because we are only going and nobody. Second is other people are not reaching now. So that way a report was created, and then because of medicine, good medicine, getting cured, then they started trust and coming to hospital. Then slowly and gradually we earned, visited so many places, and now with 0 patient, now more than 100 patients are coming. And one thing is that when I went there, that family, their daughters and daughter's daughter, now they are coming. Third generation with their granddaughter, they are coming. So that is the biggest happiness when the grandma comes with their granddaughter, that he is our doctor. So that is how we earn the love and affection from our brothers and sisters.
Dhananjay, the second linked question to this that has been asked is, you have answered partly. I suppose if there are new nuances that you can add, that will be nice. Is about working with tribals in general. So you have mentioned about multiple tribal groups that are part of that area itself. In the video, you mentioned some name of the tribes. Also, across India, the tribal groups are found in different geographies. So when you're working with a multicultural society that way, in the same area, how do you train your team for the same?
Yes, 2-3 points I will like to say. Tribal, when we say tribal, he is not a one tribal community. There is no one tribal all over India. I will say one small statistics. Total tribal population of India is 8.6%. That is 104 million tribals are there, 705 communities. So there is no one tribal. Out of that, 2.6 million are primitive tribes. That is particularly vulnerable tribal groups. So in tribals itself, there are, we can say, 3 types of tribals. One is developed tribes with education and landholding. They are actually scheduled tribes, but they may not be backward. So they are living their own lifestyle and living happily. Second will be now upcoming tribes who are having education and other facilities. But most important, where we are trying to work, in Wayanad itself, there are these Paniya, Adiya. You can see, when you saw video, you must have seen these Negroid types Paniya. They are the most backward and primitive tribes. No land holdings, no education, and no inclination to go to schools. So, and unfortunately, all the communicable diseases like diarrhea, tuberculosis, all the diseases, they are suffering. So we are trying to concentrate on these particularly vulnerable tribal groups, so that they are helped to come out of this disadvantaged situation. That is where this Swasthya Mitra scheme comes into picture. So we have trained, I told you, 125 our one teacher schools. They are working in this type of areas. They are from the teachers are from the local community, so they know the local people. They are given the Swasthya Mitra training, first aid, and now Niramaya kits are being distributed. So they are the actual link, because they are from the local community, and our medical team goes there, with their support, and that is the entry point. Actually, our this one teacher schools and Swasthya Mitra, they are the entry point to these remote areas. And one good thing about Wayanad, even if it is a politically sensitive area, Vivekananda Medical Mission, because of our committed work for last 50 years, the government administration has also recognized medical mission, and we are not required to take any permission to conduct medical camps, because we are already supported by central government also for a mobile medical unit and hospital. So authorized service center means authorized, we are authorized to visit tribal areas and conduct medical camps also, and for helping others. So with the help of Swasthya Mitra, that is the biggest helpful man anywhere in India, this Arograkshak or Swasthya Mitra will be our main area of work, and he will be our contact person or sampark to reach our remote areas.
So Dhananjay, you said it beautifully. Ki overall, you have sort of got embedded in the community with Arogya Mitras. For every bit of work that happens in the community, Arogya Mitras become first point of contact. Overall, when you began this journey, finding the few Arogya Mitras, if you can share some stories around how this entire network of Arogya Mitras got ready, and what kind of traits do you look for when you look for a good Arogya Mitra?
So really, but 2-3 things are there. I will tell one. Last month, I came to Delhi to attend one conference organized by National Commission for Scheduled Tribes. For the agenda was tribal health and evaluation of policy discussion. In that policy meeting, so many NGOs and government officials were there, and they expressed their opinion on how to go about the health of the tribals. Most interesting aspect or highlight of the discussion was that we should not say that the tribal health, they are living an unhealthy lifestyle. Most important, they are living a healthy lifestyle, because what we are saying, organic food and other things, they don't have these bad habits. So to find out, we can help them in their new tribal health, but they, according to what they are living for last thousands of years, so they have got their own lifestyle, and with their lifestyle, they were living a healthy life actually. So we should not take any specific credit that we are trying to do something for them. So that approach that we are going and solving their problem, we can help them to live a better health. That is the our aim should be, and not saying that they are, because they are uneducated and disconnected from the society, they don't become backward, or that type of we are forward and backward. That of concept is itself is a falsely wrong ideas in our minds. So we should see that they are our brothers and living a different way of life and healthy lifestyle actually there. If we compare new approach, organic farming and organic food and this addiction type, so they were living happily but disconnected. So whatever our point is that we should be able to help the tribal community if to, there are about tribal health, 5 points I will tell. If we see why there is problem about tribal health, one is the poor health seeking behavior. They don't go to hospital to take treatment. Second is the burden of the diseases. I told you about pneumonia and other things. So most of these tuberculosis and communicable diseases are very high in this type of, because of their lifestyle and so many other malnutrition, safe motherhood, mental health, and now addictions because of our exposure to the non-tribes. So poor health seeking behavior, they prefer local quacks. Second is local traditional healers. Third is home medicines. And lastly, they will say that this is a God's wish or curse or hostile spirits. So these are the challenges we face. And this is where our Swasthya Mitra and our work comes into picture, that this poor health seeking behavior should be changed, and we can help them to have a better lifestyle.
Dhananjay, a question from Sushant. Was there a moment you felt you should go back to the city and start practicing there?
No. No, going back to Nagpur, you see, in life, so many ups and downs are there. Basically, when we decide that we are going to work in tribal areas, so that the glamour is there, but glamour part apart, in day-to-day real life is different than what we see in films, and glamour part of, apart from that, really there is nitty-gritty of life is very difficult. When you go to a place like Wayanad, you don't know language and no local support. Sometimes, even if we are working, that type of support is actually not forthcoming, because they told that no doctor was available. Actually, no doctor still is coming from Kerala to work for tribal areas. We have to pay and get him motivated. Not so. Then workers, Swasthya Mitra. That the question was there: how you created Swasthya Mitra? That I will tell in short. What I was telling, that there are own from the tribal communities who are now educated, then they feel that something should be done for their own community. From this type, the people who are motivated to work for we selected these students, and then we make them Swasthya Mitra. That was the question. So to get workers, then finance, and then result. These three things are there in life. In tribal areas, all the three, whatever you decide may not be forthcoming. Then there will be sometimes many times there will be difficult situation how to survive. But once we decide that we are working there and our mind is strong, we have to keep our mind strong and focused on our aims. Because when we say Sangha Prarthana Kantaka Kirana Marga, so there will be always difficulties in our life, and especially in this type of, there will be only difficulties. So we have to overcome them, and what out of 10, even if we overcome 6, that should give us satisfaction, and be happy that something what we wanted to do has been done. Everything not possible. So, but downs are there. So we have to again regenerate, talk with our seniors, talk with local people. Then they say that yes, that was the another thing. Once I went in 1980, by 85, my mother said that you return back. So actually that question is there. So she agreed that when in 80 I went there with their permission, that 2 years you can go and then come back to Nagpur. Then when they came to see our work, then she was also satisfied that it is good that I settle down. Then she said that you settle down with marriage. So then our local workers, Sangha workers, Vanvasi, then they discussed with one, I will tell about my marriage also. At Calicut, which is nearly 80 kilometers from here, Shri Sriram Gurjar, he was senior Sangha worker, his daughter. Then they discussed, talked with her. Then she agreed, and then my mother also agreed that if somebody's company is there, then she has no she will not oppose, and she agreed to allow me to work in Wayanad. So my wife Sujata, she's here for last 40 years with me. You can imagine 40 years ago, it is very difficult situation. Sometimes no electricity, no entertainment, no buses to Calicut, no gas. So in all this difficult situation, she has work means stayed in Wayanad and supported my family and myself. And I am fortunate to have two daughters. One is Aditi, she is engineer in Nagpur. Second doctor is Gayatri. She has passed MBBS and now she is doing MD anesthesia in AIMS Patna. And she was working in our hospital also for them. After MD finishing, she will come back. So many good things have happened, and we are trying to live as happily as possible with support from all.
Dhananjay, broadly, when we hear about Kerala, we hear a lot of good things about the healthcare. It's a model, often the rural development, the healthcare is talked about. When I'm hearing you, I'm hearing about the unavailability of doctors, unavailability of healthcare. How different is Wayanad from the rest of Kerala, and why this difference, if there is a difference?
So difference is always there, because it haves and have-nots problem, because most of these facilities, especially education, health, are cornered by non-tribes. And tribes, because they are living away from the mainstream and disconnected from the society, they are always at the mercy of all the ill wills, because I told about floods, sickle cell disease, all these problems are only faced by our Vanvasi brethren and not by non-tribes. So sickle cell anemia itself is a tribal disease. It is so many in other, in Nagpur, when I was there, it was there in SC Mahar community, then tribal gold community, in Gujarat, Rajasthan, so many tribal communities it is there. So in Wayanad also, because nearly 2,000 sickle cell patients are there and nearly 25,000 will be carriers. So we are trying to help them. That was actually because of medical mission only this major tribal problem was solved, not fully solved, controlled, and diagnosis is made, treatment is being done, counseling is there. So in government doctors also, they refer their patients to our hospital. So one of the biggest contribution of medical mission is about sickle cell disease, and we are fortunate to have a good support from All India Institute of Medical Science, Delhi. Second part we have done is tuberculosis. We are one of the main centers of RNTPC, and we got best NGO award by Kerala state government for doing TB. Nearly from the Kerala government, we got the best NGO award for TB. So all the de-addiction also we were doing from the excise department, Kerala government, we have done de-addiction program. Then we were mother NGO.
Sorry.
So all these things are needed for our betterment of health of our Vanvasis, and with even if all the government machineries were there, but this disadvantaged section, we are trying to do help maximum. So they are happy to come to Muttil and take advantage of our services.
Ji. Overall, Dhananjay, my team members are sitting here, and one question that people have with all of this is, what has been the government doing for it? So, for example, we hear about public health, we hear about health insurance, we hear about telemedicine. How have government schemes benefited the tribal population in Wayanad, Kerala? And has there been any positive change about what government has been doing or had been doing or currently is doing, especially to take care of sickle cell or other public health issues there?
Yes. Actually, I'm not taking credit, but since I came here, or you can say up to 5 years ago, Vivekananda Medical Mission was monopoly for tribal health, because we are the only hospital catering to the tribal health for our hospital, and then mobile medical unit, sickle cell disease. So everybody, when there was no other hospitals for general public also, in last 5 years, the government of Kerala has spent a lot of money in PSCs and CSCs, and now there are a lot of hospitals are there, and now one private medical college is also there. But till it came, Medical Mission Hospital at Muttil was referred to as a small medical college for tribals. So what maximum we can do, we did, and still we are doing. And with government, unfortunately, the insurance scheme is there, but same problem comes that the non-tribes, especially here Muslims and others, they take advantages of all these facilities. And poor tribes, they are not enrolled properly, and when they go, their names are not there. So the health facilities are insured in medical college also. Unless you have got insurance card, full treatment free is not given. So we are trying to help them to get this enrolled into insurance. So basics, primary health care and this sickle cell and other things, still the tribals are not very much, we can say that change is there, but still there is huge disparity between the availability and the utility to our Vanvasi burden. So we are trying to help tribals and government also to bridge the gap and maximum make them health conscious and healthy.
Dhananjay, someone has asked, if someone wants to join your mission and join your and volunteer at your place, what? Yes. And he is not a doctor, what can he do? Can he join as a volunteer for some time? And what all responsibilities or work he can contribute in SVMM?
What type of work he can do? He can directly communicate. You can give my email address and WhatsApp number. He can volunteer what type of work he can do, because if he comes and even if works for, because we have got schools and other things, medical camps are there, hospital work, accounting, so many, any type of activity he can willing to do for helpful to our tribal communities. He is always welcome, and we'll be glad to welcome his services.
So there are two connected questions, one about technology, Dhananjay, and one about high-end medical care. So the question is about how do you handle emergency cases, if there are any, both amongst tribals as well as in your hospital. And second, telemedicine support or digital med support can potentially bridge some gap in this. Is there any plan for such intervention? Will that be relevant there?
Yes, that is most important. First is emergencies. We have got medically, we can manage most of the things in hospital. In last year, because with Sewa International, we have got ICU also, where cardiologist is coming. So general medical emergencies, we are tackling maximum, and we have got ambulance. So if there is literally, we cannot do, and especially surgical cases, we refer them to medical college, and we immediately take him. Sometimes our doctor also accompanying him in very bad situation, and he will be taken to medical college for further treatment. Telemedicine is most relevant in this type of all over India, tribal and rural areas. It is very important, and there was discussion also in this forum that how telemedicine can be useful. I have given 2-3 suggestions. One is the mobile medical unit with telemedicine, so that in that health policy meeting also there was discussion how it can be taken, because sometimes doctors are not available in rural areas. So I suggested that the telemedicine with medical unit reaching the rural areas, where remote areas, and our Swasthya Mitra medical unit and telemedical, that unit can be established there, which is the sub-center, so that the doctor sitting in our hospital can directly see the patient and advise whatever is necessary, because the whole team will be there. Laboratory technician, nurses will be there, and medicines will be there. So immediately what can be done for the patient in this, that can be always advised, and if it is necessary, he can advise him to come to hospital, and our ambulance can bring him back to the hospital for further treatment. So this is the minimum thing, the way telemedicine can be useful. Otherwise, the telemedicine units can be established in so many places, and our doctor, even if it not 24 hours, just like our OPD, sometimes they can, our Swasthya Mitra and local health workers, with what I told you, then they can directly communicate. So this way, our remote areas, disadvantaged community can be helped.
One last question, Dhananjay ji. Dhananjay ji, overall, when there are unique problems, there are unique solutions that come in. So if you'd just like to list down or count the innovations that have happened in the last 30 years or 40 years at SVMM, are there some innovations that you'd like people to remember and learn from? Because there are some engineers in the audience and they might wish to take up some challenges and work on them. So the solutions that have emerged or solutions that you're looking for, anything on this side if you'd like to share?
Health solution or
any technological solution that helped you either diagnose a disease or treat a disease better, or some problems that you're currently facing that you'd want someone to take up that problem and work on the solution.
Technologically or generally?
Technologically.
Technologically, this, what we discussed just now, telemedicine is most important technological innovation which will be useful, because it is, there are so many loose points in this telemedicine sector, because one is how to run it from the hospital, with then the app which is used, application, then utility to the at the end point, because sometimes there will not be network, and then mobile units are mobile dispensary, means our mobiles are necessary, network is necessary. So many loose points are there. Then there are some medical legal problems are there, whether the telemedicine will be always useful or there will be any another, because if wrong, I'm just giving one example, there was discussion also that some wrong diagnosis and wrong treatment, and if there is medical legal case, then the doctor will be in difficulty. So some sort of clarity has not been established, but still I feel that, or there is a general agreement that telemedicine or telehealth can be implemented in, especially in these remote areas, so that a base hospital, a mobile medical unit, just like Swasthya Mitra, so some sort of technologically which is useful to this, not only Wayanad, any areas, and cost effective and user friendly. So this type of unit is developed. It is not available at present. So our technological team, if they can develop a user-friendly and cost-effective, useful, then it will be very nice.
So that is all for today from our side, Dhananjay ji. Overall, I would just like to end, request you for an end note for young people like me and all of us here. Your message for young social workers, if you'd like to pass on any message on what do young people feel or should do about thinking about deciding a life dedicated to a social cause. What can we do right now to make ourselves better prepared for the same?
Yes, when we are studying or something, any medicine or other thing, we want to become a doctor, become specialist. Then the usual is to make money, and then this is our natural lifestyle. My opinion is that when, even if you are a doctor or engineer or any other field, you should have some passion. Only studying, going to school and taking big degrees and making money cannot be the aim of our life. We should have some passion in our life apart from this regular life. Then you have passion to help our community, because you are living in community, you are living in family, your community, then our country. So when you are getting something from our society, it is our duty that we do in return. So that should be in our way of thinking, that by my action, even if it is small, something can be done. The way I help my family, my society, and that will give my more satisfaction than making more money. So if you have some passion and work for society also, that will be most happiness to your life.
Thank you so much, Dhananjay ji. It was a pleasure listening to you, and it was a delight understanding your life journey, the difficulties that were faced, and the entire overcoming period of how we overcome those challenges. Thank you so much for the insights, the journey, and your experiences. It was inspiring, enriching, and overall very empowering to hear the entire journey of SVMM and the service that you have provided. Thank you so much.
Dhanyavad.
Shyamji, any final words from you?
I thank Dr. Vivek Sagdeo ji for joining us for Sewa Samwaad. And then, of course, his experience had been unique and that we all enjoyed. And more so, it was a learning experience for all of us because of the different settings of life, lifestyle, language, even culture in a sense, had been challenges. And yet he had successfully established a hospital, as he narrated, not growing vertically, but horizontally, taking doctors and hospitals and nurses to the Vanvasi villages, the huts, and being one amongst them. As you had asked a question, gaining their confidence is one of the biggest challenge. And they keep away because they are not very good at communicating unless and until you are well known to them. I think that's the message, that it's the perseverance and walking the talk towards achieving the goal that mattered for him, and he did it. So thank you very much. धन्यवाद डॉक्टर सखदेव जी. ऐसे ही अपना संबंध बना रहे. सेवा से हम अधिकतम ट्राइब्स तक, लोगों तक पहुंचे और उनके जीवन में आनंद लाए, उनको सुस्वास्थ्य दे, इस प्रयास में हम जुटे रहे. धन्यवाद. Over to Abhishek ji.
So the next Sewa Samwaad will be organized on 11th of June, and we'll soon share the details of the next Sewa Samwaad with all of you.